to wash my hands and then verify the healthcare provider's orders. So we have Sleepy White. Her ID is 369121518. Her date of birth is 1660. Her allergies are Tigan and tetracycline. Ordered is Phenergan, which is supposed to be given IM injection. Ordered is 12.5 milligrams, Q6 hours, PRN nausea. And it was last given at 8 o'clock. It is now 1600, so enough time has passed to where it's safe to give. Now you want to prepare the math. So you need to get the vial. This is Phenergan. Go ahead and get the syringe that you would need. And needle. For IM, I'm giving a 23 gauge needle because it'll reach the muscle. So on my vial we have 25 milligrams per ml. Ordered is 12.5 milligrams, so you're going to do your med math. Okay, so now you do it all again. You always want to do your med math twice. You don't want to give your patient the wrong dose. Now check it on your calculator again. Okay, so I got the same thing both times. So it's okay to start preparing it. So, get your alcohol wipes. You can clean the top. And this Phenergan does not expire until 2030, so it is okay to use. Our needle is intact and opened and does not expire until 2020. Our syringe is intact, unopened, and unexpired. And our Phenergan was also unexpired. So we want to go ahead and open this partially. You want to make sure that you keep the end of this sterile. And then put these on there, make sure it's on there really good. So it's really tight. And now it's ready. And you want to bump the air. Get the cap off. There we go. It's hard to get this one started. We are giving 1/2 of an ml. So I'm going to put that where I want it. And then put that in there and then inject the air. Turn it upside down. Remember, you're going to pull back a little more than what you actually want so that you can get the air out. So I've got the amount I need. Now I'm going to do my one-handed recap. And I had to get 1/2 of an ml, so I'm going to go show my instructor.
1/2 ml.
Okay. Now you want to prepare your tape. This is trash. Just trash out of your way. So you want to prepare your tape so that you can do your med checks. So my patient is Sleepy White. On hand we have Phenergan, 25 milligrams per 1 ml. In my syringe we have Phenergan, 12.5 milligrams. So we have 1/2 definite male. And then the date is 9/13/16. It is 1600, and my initials are ALUKS. And you put that on the syringe. Okay. Now you are ready to start your med checks. Okay. So the patient's name is Sleepy White. Her ID is 369121518. Date of birth is 1660. Her allergies are Tigan and tetracycline. We are giving Phenergan, which is not one of her allergies. Ordered is Phenergan, 12.5 milligrams, Q6 hours, PRN for nausea. We are giving it IM. Is last given at 8 o'clock and is now 1600, so enough time has passed for us to safely give it. It's not one of her allergies. In our hand, we have Sleepy White. But on hand, we have Phenergan, 25 milligrams per ml, which is intact, unopened, and expired until 2030. I prepared 12.5 milligrams, so 0.5 mLs. I'm giving it now at 1600 because enough time has safely passed to give it, and I'm giving it IM in the ventrogluteal. I've decided. So I'm going to do another med check. I'm going to say the third for the bedside. So we have Sleepy White, 369121518. Her date of birth is 1660. Her allergies are Tigan and tetracycline. Ordered is Phenergan injection, 12.5 milligrams, Q6 hours, PRN nausea. We're giving it IM, so we're going to give it in the ventrogluteal. It was last given at 8 o'clock. 6 hours has passed because it is now 1600, so it is safe to give. In my hand is Sleepy White. On hand we have Phenergan, 25 milligrams per ml, which doesn't expire until 2030, so it's okay to give. We have Phenergan, orders 12.5 milligrams, so I have 0.5 mLs in my syringe. I'm giving it now 1600 because enough time has passed, and I'm giving it IM in the ventrogluteal. Okay, so now you're going to get out of everything so you can take a step to the patient's room. So go ahead and take this so that you can perform your last med check. You take alcohol wipes, you just syringe, your MAR, your pen so that you can document, and you're done. Okay, so now it's time to go into the patient's room. Hello, Miss Sleepy White. I'm Adrian. I'm going to be your student nurse today.
Hi, Adrian.
I'm going to give you your Phenergan injection. Is that okay?
Yeah, I'm nauseated.
Okay, well that's what we're going to give it to you. So wash your hands. Can you tell me your name and date of birth?
Sleepy White. I don't remember my birthday.
Your birthday is 1660, and on the MAR I have that your ID is 3691258. So her ID band is back here. We have 369121518, and it's Sleepy White, date of birth 1660. So everything's correct. So this is the right person. So you want to go ahead and do your third med check because you're at the bedside. So her name is Sleepy White. ID is 369121518. Her date of birth is 1660. IRDs are Tigan, tetracycline. We're not giving either one of those. We are giving ordered Phenergan injection, 12.5 milligrams, which we have is 0.5 mLs. It's given Q6 PRN for nausea. We're giving it IM in the ventrogluteal. Is last given at 8 o'clock. It is now 1600, so it's safe to give. In my hand, we have Sleepy White, Phenergan, 25 milligrams per ml, which doesn't expire until 2030. I have 12.5 milligrams, which is 0.5 mLs in my syringe. I'm giving it now at 1600 in the ventrogluteal via IM. So we are good there. Can you tell me where you are right now?
I'm at UK College of Nursing. I'm not real sure why.
And can you tell me what month it is?
It's September.
And can you tell me what season it is?
Football season. Go Cats!
Yeah, that's right. I don't know about Go Cats right now.
Yeah, well,
Okay.
what are you going to do?
Gonna put that valve down. tell me your allergies?
Tetracycline and Tigan.
That's right. That's what I have on the MAR. That's not what we're giving you, so it's okay. Put your gloves on. You washed your hands when you came in here. Okay, I'm going to get you uncovered. I'm going to flip you up onto your side. We're going to give it in the ventrocluteal. So I'm going to find the greater trochanter and follow my hand on there. I found it. Now I'm going to put my thumb towards the umbilical, my pointer finger and middle finger across the iliac crest. And I need to pull back a little bit. And then right there is the spot I want. So this spot is free of edema or any type of bruising. Is this spot tender?
Nope.
No? Okay. Well then we'll go ahead and use it for your injection site. So you want to get it clean. Just leave right there so you don't lose your spot. Okay. I'm going to take the cap off. Move this. Hold the skin taut with that non-dominant hand, and then send it in on the count of 3 like a dart. 1, 2, 3. Stabilize it with that non-dominant hand. Send in the medicine. Remove the stabilizing hand and pull it out. Pull straight out. Okay, so safety cap is on. I'm gonna add a little bit of pressure because it looks like we had a little leakage. Is that too bad?
Nope. Didn't even feel it.
Didn't even feel it. That's great. That's what we want. I'm gonna lay this out of my way for a minute so I can get her back comfortable. And cover her back up. Take this off. Put this in the sharps container. I'm gonna put her bed rail back up. Lower her down to her lowest height. And you wanna wash your hands. And then document that you gave that and their right ventrocluteal. You can get her Phenergan at 1600, write down the time, and their right ventrocluteal, and then say that you gave it, or say that your initials are UKSN. So the time, place, and initials.